The COVID pandemic has transformed our lifestyle habits, leading to a reduction in cases of infectious diseases. That's good news for the public health, but it's brought financial stress to some hospital departments and private practices.
Last year, doctors in Taiwan saw about 6% fewer patients than in 2019. The biggest decline in patients was reported by ear, nose, and throat specialists at private clinics, who say 25% fewer patients. To help struggling clinics, the National Health Insurance Administration is planning a subsidy scheme worth 450 million NT dollars.
Before the pandemic, the waiting room was often filled to capacity at this private clinic. Peek inside now and you'll only find a handful of people.
A lot of people wear masks on the street. In public spaces, almost everyone is wearing a mask. There's alcohol everywhere to wash your hands with, and people everywhere use soap to wash their hands. That is why the number of respiratory infections has plummeted.
According to the National Health Insurance Administration, doctors' visits fell by 6.2% in 2020 year-on-year. In hospitals, the biggest drop was in visits to pediatricians, where patient volume fell by 17.3%. Among private practices, ENT clinics suffered most, with patient volume falling by 25%. Pediatricians in private practice reported more than a 20% reduction. Due to the pandemic, people have been choosing not to go to the hospital for minor ailments such as colds.
Many viruses spread through international travel, especially flu viruses. For these diseases, there really have been fewer cases. For example, this past winter, we barely saw any flu cases. This had a huge impact on medical specialties that rely on outpatient visits. One is ENT, the other is pediatrics. In both of these, visits have fallen by 20% or more.
Patient numbers fell for some hospital departments but increased for others, such as hematology-oncology and rheumatology-immunology. As for private clinics, the biggest gains were reported by endocrinologists and psychiatrists. The reason for this could be that these doctors see patients with chronic conditions who require regular visits to pick up prescriptions. The National Health Insurance Administration says it's planning to give out 450 million NT in subsidies to help struggling clinics.
Clinics whose 2020 operations did not reach 80% of the level in 2019 will receive subsidies. That is about 1,600 clinics, which will be given a total of 450 million NT.
Amid the pandemic, constant mask wearing and hand washing have inadvertently had an impact on the patterns of medical visits.